So conscientious objection raises the ethical issue of the place of individuals' own values and what they think is right or wrong within medicine. Public medicine, as opposed to private medicine, is what's called a public good. That is, it's paid for by taxation and it's available to everyone. What's essential is that public goods are available fairly and efficiently to everyone. And whatever place values have within the distribution of public goods doesn't compromise people's access. So where a medical treatment is legal and principles of distributive justice allow it, it's beneficial to the patient and it's desired by the patient, they ought to have access to that treatment. How we accommodate values within medicine will depend on the impact on patient care, but when it compromises patient care, those values need to be restricted. And this could be done, for example, by referring to other physicians in a timely and efficient way, or indeed in restricting access to certain professions where values of that individual conflict with the delivery of basic public medicine or public goods. So it's not unfair to, for example, say that in order to be an obstetrician or a gynecologist, you have to be prepared to offer contraception or abortion services if those are a part of the public good. When doctors have a certain value, it's my belief that they're entitled to discuss with the patient their values and what they believe is right or wrong. But they ought to respect the patient's choice in the end if the patient is requesting a basic public service or public good. So dialogue is certainly permissible, but when it comes to restricting access, those discussions should not occur at the bedside, but at the public policy or parliamentary level. It's important to recognise also that values are not just religious values. People without religious values can have strong beliefs about what is right or wrong that may have a role or not have a role within the delivery of healthcare. So for example, people offering infertility services, treatment of infertility, may have beliefs about fitness to parent based on religious beliefs, for example, around whether gay couples or single women ought to be bringing up children. Or they may be non-religious in terms of use of societal resources or ability to parent and care for a child. Those values ought not influence a basic provision of service in an unfair or inefficient way. Doctors may be free to give advice and try to persuade people who they believe are making a mistake to change their minds, but in the end, they ought to respect the patient's values. So people's values are very important, patients' values are important, doctors' values are important, but public medicine needs to give a basic set of services both to patients and doctors need to be prepared to deliver those. And conscientious objection challenges the extent to which our values can impose on other people's lives. But it's a basic liberal principle that we ought to be free to live our own lives as far as our actions affect only ourselves according to our own values. So if you disagree with homosexuality or with contraception or with abortion or with euthanasia, don't engage in those practices. But when our actions affect others, particularly when we're in a public service role in delivering a public good, those values ought not dictate to other people how they should live their lives.